The Soft-ECC with Chylon, the next best endocervical curette. Hello, I'm Dr. Kathy Hahn, a board-certified obstetrician-gynecologist and investigator in the recent clinical trial comparing the Soft-ECC to the Kevorkian endocervical curette. I practice in Laguna Hills, California with the Orange Coast Women's Medical Group. I would now like to take this opportunity to introduce you to the Soft-ECC endocervical curette. What is Chylon? Chylon is the patent-pending, nylon-based medical fabric used in the Soft-ECC, which can buckle, fracture, and collect mucosal and non-mucosal epithelial tissue when the curette and its edges are pressed and rotated or agitated on the tissue surface. The Soft-ECC handle can be gripped easily and rotated with one hand or with pincher finger guides at the rotation indentation. The rotation can be counted using the rotation marker notches when the fabric is entirely in the endocervix and no longer visible. The device fabric is at the tapered tip, which can be separated from the handle at the fracture groove. This is a closer view of the tapered tip and biopsy fabric. Note, the fabric is on one face of the device and must be rotated to capture tissue from the entire endocervical canal. This is a closer view of the handle and a second rotation marker near the handle. The handle has grooves to assist with easy rotation using one hand or two. The two most common clinical settings for endocervical curettage are during colposcopy. We perform ECC routinely during colposcopy, where some physicians reserve this for unsatisfactory colposcopy. Both practices are acceptable. We also perform ECC to evaluate perimenopausal or postmenopausal bleeding. ECC is always contraindicated in pregnancy. The Soft-ECC tip is smaller than other curettes to allow for easy entry. The curette only has to be inserted once, unlike other curettes that are inserted and removed repeatedly to cut and scrape the canal. When the Soft-ECC is inserted at least halfway or completely into the canal, it is simply rotated while pressing the fabric against the inner walls. The Chylon fabric and edges of the device both scrape and collect the tissue inside the fabric, like a basket, so there is no need to retrieve the tissue with a cider brush or forceps. The abundant sample will fill the fabric. The Soft-ECC was designed to provide an abundant sample and avoid the insufficient biopsy result that sometimes occurs with an inadequate curettage. This avoids recalling the patient back to repeat the procedure. How do you perform the Soft-ECC curettage? First, place the handle of the device in your palm, like so. Second, close your hand around the Soft-ECC with your fingers along the ridges, noting the proximal rotation marker notch. Third, if the pad is not visible while rotating, the rotation notch will guide you to the number of rotations you have performed. There's also a rotation notch just distal to the fracture groove if you prefer. Fourth, insert the Soft-ECC slowly and carefully until the tapered tip is no longer visible. Do not insert past the internal os. Sometimes the cervix will be short or the os tight. Because the tip is less than 1 millimeter in diameter, it will almost always fit into the cervix. With gentle pressure, attempt to insert the pad at least halfway into the cervix, then rotate the device. This has been shown to obtain sufficient endocervical mucosa for a diagnostic biopsy. Once the tip is inserted into the canal, the notch will guide you to where the fabric face is. Press the fabric against the canal and rotate the device 3 to 5 complete rotations clockwise, then counterclockwise. Use the rotation markers to assist you in counting the number of rotations. Again, do not force the device into a stenotic os or insert the device past the internal endocervical os. If at least half the pad does not enter into the canal, consider dilation of the cervix prior to performing the curettage procedure. When the pad is pressed and rotated against the endocervical canal, it will buckle, fracture, and dislodge intact tissue strips that will collect within the hooked Chylon fabric. Once this biopsy is obtained, withdraw the device and fracture the tip from the handle at the recessed fracture line. Then place the tip of the device with the tissue entrapped in the fabric basket into the vial of fixative. The vial should be clearly marked with the patient identification and handled consistently with the instructions for any cervical curettage specimen by your clinical laboratory. When the specimen is received in the lab, the tissue will be teased from the fabric onto a Telfa pad or directly into the vial. A tweezer, scalpel, or preferably a comb can be used to release the tissue completely and easily to prepare for processing. These are two endocervical curettage samples taken with the Soft-ECC curette. The image on the left is low power and the image on the right is high power. The tissue samples are abundant, diagnostic, and reveal the full thickness of the epithelium and stroma. Dr. Winter and associates reported the full thickness transepithelial evidence at the minimally invasive gynecology meeting of the AAGL in November of 2010. They biopsied discarded hysterectomy specimens to document gaps in the endocervical epithelium where the curettage biopsy occurred. Do not perform Soft-ECC or any endocervical curettage in 1. Patients with known bleeding disorders or those on anticoagulant therapy. 2. Patients with a suspected active cervicitis. 3. Patients with a known allergy to nylon or acrylic plastic. 4. The Soft-ECC should not be performed on exocervical biopsy cases. Number 5. Endocervical biopsy by any method is contraindicated in pregnancy. Bleeding is common during any endocervical curettage procedure and can occur with Soft-ECC. It is usually self-limiting and can be observed. It is very unlikely the tip would separate from the handle during the procedure. If this occurs, use a clamp or forceps to retrieve the tip. If the tip is filled with tissue, send the sample to the lab. If the sample is insufficient, repeat the procedure with a new device. So in summary, the Soft-ECC is used during colposcopy or during the evaluation of abnormal uterine bleeding. It was designed to fit into most cervixes and can be minimally invasive. It can be rotated instead of repeatedly inserted and withdrawn, a notable difference by the patient. Be careful not to advance the device past the internal os. An abundant tissue sample is likely if used with the proper technique. The specimen can be processed just like any other endocervical curettage specimen. Never perform Soft-ECC or any endocervical curettage on a pregnant patient. Thank you for your attention, and we hope you will find the Soft-ECC device the next best endocervical curette.